Let's talk about knee arthritis in young adults. Recently, I had a 40-year-old gentleman who's quite active. He has an amateur professional. He plays regular badminton and other sporting activities. Who's been having constant knee pain for the last 5 to 6 years. We've done all the investigations and X-rays and MRI, and it's been found that he's got grade 4 osteoarthritis involving his right knee. So what are the options now do we have? Because we know that patient who has grade 4 or severe knee arthritis, the permanent solution would be a total knee replacement. So if you offer him a knee replacement at his age at 40, what are the drawbacks or what are the disadvantages or advantages if he has knee replacement at this age? My name is Dr. D. Bharani Kumar. I'm an orthopedic surgeon at Apollo Specialty Hospitals, Vanagram. I've been doing orthopedics for the last 20-25 years, and I've been trained in UK basically in knee management. Let's talk about the options available if for him who's 40 years old, who's quite active, who has got severe knee arthritis or grade 4 OA. If you offer him the total knee replacement, the disadvantage or the main disadvantage would be for him that first thing would be is that he may not be able to do his active sporting life, which he may have to cut down, because even though the knee replacement is quite good for pain relief, it doesn't allow them to carry on with their active lifestyle. Second, I think the most important factor would be that all implants or the knee implants which we use has a certain lifespan, the durable period. So I would say normally if you do a knee replacement at his age of 40, it may last another 10 to 15 years, and then we might have to think about another surgery. So do we have any other option which would avoid knee replacement at least for another 10-15 years? And how do you relieve his pain? If you look at it, there are two other different common options now recently we can think of. One, whether we can the main reason, as I told you before, what is the reason for the knee pain or knee arthritis in this case? He's got arthritis, which means that the cartilage is completely worn off, and that is what is causing his knee pain. So two things we can try without doing a replacement therapy or without doing a knee replacement would be one, whether can we regrow the cartilage back? I think that to a certain extent might help him. So when we look at patients in the younger age group, 40 and below, and if we have a cartilage defect or there's loss of cartilage, then we tend nowadays try to regenerate the cartilage back with different means. Either we can take a cartilage from a non-weight bearing area in the same knee joint and replace it there, or we can grow cartilage in a lab and then reimplant it again. So that is one way, that is regenerative therapy is a possibility depending on the amount of damage or amount of injury to the cartilage he has got. The second option or a more reliable option would be that if the patient has got arthritis mainly affecting one side of the knee joint, that means arthritis can happen either on the medial compartment or lateral compartment. So if he has arthritis one side of the knee joint, and if he's active and he wants to carry on with his active lifestyle, then what we would recommend would be the better option would be to do called as a realignment osteotomy, where you would correct the knee in such a way that the weight bearing surface is transferred from the affected side to the non-affected side. And what this does in sense is it relieves his pain, but the advantage being that he can carry on with his normal day-to-day activities. So if I have a young patient or the 40-year-old gentleman who wants to continue his active lifestyle, then I would probably think in terms of a realignment osteotomy rather than a knee replacement at this age group. I hope this answers your questions.